I'm Avery Irons. I'm the Associate for Technical Assistance at the New York State Youth Justice Institute. Welcome to Are the Kids All Right? COVID-19 and Youth. We are so happy that you are joining us today. Thank you so much for your time and space and energy. We have a full house today and for the rest of the week. I also want to thank our panels of scholars, advocates, and practitioners for leading us in these urgently needed conversations. Before we introduce them, my colleagues and I want to take a few minutes and briefly cover a couple of housekeeping matters. So I'll start off just by saying if you have technical issues during the course of the webinar, please email us at youthjustice@albany.edu. That link or that email address will be in the panel and we will offer you technical support. With that, I will turn it over to my colleague, Alicia, to handle some other tech issues.
Hello, my name is Alicia and I'm a research assistant at the Youth Justice Institute. Thank you again for joining us. As our presenters today are speaking, you are welcome to ask questions in the Q&A section or in the Facebook comments as we go along. We will have some time at the end of the session for these questions, and in the case that we do not get to all of them, we are keeping track of them and will do our best after the conclusion of the forum to answer remaining questions. We have Angelique McAlpine of Drawing Impact providing live digital visual note-taking. Her screen will be projecting alongside the panelists' videos. You can adjust the relative size of the panelists' videos and Angelique's drawings by shifting the vertical sliding bar to the left or the right to suit your preference. Please feel free to try that right now. This session and all of our sessions are being recorded and will be available to watch at a later point.
Hi everyone, my name is Amariah and I'm a YJI scholar. We would like to invite you to engage with your fellow attendees throughout the week and afterwards on our online Padlet board, which we will link in the chat. So this is a virtual bulletin board intended to serve as a collaboration and networking space similar to at a professional in-person conference. And now I'd like to introduce Dr. Gzhel, Executive Director of the New York State Youth Justice Institute, to present some opening remarks as we begin this session.
Thanks, Amariah, and welcome to all of you to this forum on COVID-19 and youth, hosted by the New York State Youth Justice Institute. My name is Gzhel, and I'm the Executive Director of the YJI. This forum is designed to bring together insights from multiple disciplines and from diverse professional fields to discuss three big questions. One, what are the current impacts of the pandemic on youth? Two, what are the foreseeable impacts of this crisis on this population long term? And three, what practice and policy innovations have emerged out of this situation that might lend themselves to sustainable efforts moving forward? While children, teens, and young adults are not the face of this crisis, a recent report by the United Nations points out that they risk being among its biggest victims. Everywhere, the report states, youth are being affected, especially by the socioeconomic impacts of the pandemic. Just in the past few months, an entire generation of children have had their education upended. Teens considering college this fall might have to change their plans to help unemployed parents at home. Young adults graduating college now face a dire economic crisis. We know from previous health emergencies that children are at heightened risk of exploitation, violence, and abuse when schools are closed, when social services are interrupted, and movement is restricted. And throughout all of this, members of minority groups are most seriously affected. This is a universal crisis, and for many, the impact will be lifelong. It is imperative that we try and assess the long-term consequences the situation may have over the life course of youth, and especially of youth involved in the justice system. Yet, as the old Maxim says, necessity is the mother of invention. Now, more than ever, we're offered the opportunity to rise to the occasion and engage creatively in problem solving. We have much to learn from the kids themselves in this area, I think. Just think about the 10-year-old girl in California who created a plastic curtain designed to hug her grandparents while keeping them safe from infection. or the teen in Seattle whose COVID tracking website has become a crucial resource worldwide. New policies and practices are emerging everywhere. It's in our interest to learn about them and assess their efficacy and sustainability. As much of the world begins to reopen, we invite you to collectively imagine with us the future of youth and justice post-COVID. As we do so, let's remain critical, however. Let's avoid romanticizing the past. The world as we knew it, pre-pandemic, was far from perfect. Even amidst a dystopian worldwide crisis, racism in the justice system has still found a way to rear its head, as the events in Minnesota and nationwide in the past few days made clear. Let us work to ensure that the new normal, whatever that is, that we are aspiring to achieve, doesn't bring with it the ugly vestiges of centuries past. We at the YJI are absolutely honored to have a stellar roster of experts lead these discussions over the next few days and help us get closer to answers that will guide our collective work moving forward. My many, many thanks to the panelists, to the moderators, to our plenary and keynote speakers, Michael and Pierre and Professor John Powell, who will be guiding us in exploring these questions between now and Friday. This pandemic has made us all acutely aware of how connected we all are in the world. If a crisis like this can ever have a silver lining, I would offer that this pandemic has instilled in most of us a deep sense of collective responsibility and has illustrated the critical role that data can play in policymaking. For that reason, in organizing this event, we wanted to go beyond the local, and we wanted to weave together national and global expertise in these areas to capitalize on what we can learn from each other. We are pleased to see that this effort has translated into an equally diverse audience. Many of you come from local and state governments all over the country, as well as universities, nonprofits, and research centers from near and far. Thank you so very much for being here today. It only remains for me to thank the staff and the scholars of the YJI, and especially Alicia Gagnon, Avery Irons, and Brian Rainey. Without all of you, this would not be possible. The YJI is the result of a partnership between the New York State Division of Criminal Justice Services, the New York State Office of Children and Family Services, and SUNY Albany. My thanks to our board and to the New York State Juvenile Justice Advisory Group for their unwavering support for the Institute. My thanks also to SUNY distinguished professors and former deans of the School of Criminal Justice, Bill Pridemore and Alan Lizotte, to Professor Megan Kurlichek from Penn State, to the staff of the Division for Research at SUNY, and to Diane Serpino from the Tau Foundation for all their help. Let's get started. We're gonna kick this off today with a panel thematically organized around homes. And I'd like to start with a thank you and an apology. The thanks is for sharing your insights with us today. I can't wait to hear the expertise of all of our panelists and our moderator for this session. And the apology goes in advance, as I will not be able to do justice to your credentials and your experience as I introduce each of you in a very limited amount of time. So sorry. We have with us Dr. GAYLE BECK, who is the Lillian and Maury Moss Chair of Excellence in Psychology at the University of Memphis. Her current research focuses on mental health issues following trauma exposure, with particular emphasis on post-traumatic stress disorder. Much of her funded work since assuming her current position at the University of Memphis has focused on refining treatments for chronic PTSD and disseminating training materials to underfunded agencies that serve trauma survivors. Dr. Beck also heads up the Athena project at the University of Memphis, a research clinic that provides free assessment and treatment services to women who have experienced intimate partner violence and abuse. Welcome, Dr. Beck. Also with us on this panel is DAPHNNE Brown, who's the Director of Family Involvement and Outreach for Families Together in New York State. DAPHNNE provides support to families, advocates, and service providers on family-driven care and family empowerment. She provides training and technical assistance to family-run and provider agencies in preparation for the transformation to Medicaid managed care. She has served as the family engagement consultant for the past 8 years on the New York State System of Care Expansion Grant, and currently trains family, youth, peer advocates on the high fidelity wraparound process. Welcome, DAPHNNE. Also with us today is Dr. Yo Jackson, who is a clinical child psychologist and a professor in the clinical child psychology program in the psychology department at Penn State University, and the associate director of the Child Maltreatment Solutions Network. Her research focuses on the mechanisms of resilience for youth exposed to trauma and developing models of the process from exposure to outcome for youth and families. She also studies intergenerational transmission of trauma and methods and measurement in child maltreatment research. Welcome, Dr. Jackson. And to moderate this stellar panel, we have Amanda OREN. She is a supervising attorney in the Monroe County Law Department in New York State, which provides legal representation for child protective services. Amanda began her professional trajectory advocating for children with autism who had been denied a meaningful education under the Individuals with Disabilities Education Act, or IDEA. She has also served as a public defender representing indigent clients in criminal and family court, and has worked in the policy realm advocating for New York's public defense system to provide the quality of representation required under the Constitution. Thanks to all of you for being here today. And Amanda, please take it away.
Thank you, Gzhel. I hope everyone can hear me, and hopefully I don't fade out too much. I'm having some lighting issues. I just want to thank everyone for being here today, and thank Gzhel and the YJI for hosting this event. I know this is times I don't think that any one of us have ever seen before. So this conversation is really relevant to what we're doing right now, I think, and what we're seeing. But I'm also very interested in continuing this conversation in 6 months and a year and to see really kind of where we are and what as this pandemic continues, which by all accounts, it will continue for a while. This panel obviously is homes. We're going to talk to you, and we have these great panelists that I'm excited to hear from about what the effects currently are that we know so far after these first few months of the pandemic are on young people, their families, young adults, and in particular, does that affect children who are in historically marginalized populations differently? As Gzhel said, we have 3 questions we really want to focus on. We're going to take each one of those questions one at a time, and just to give you an idea of the format, we are going to do the first question, and then we'll have each of the panelists respond. Then we'll do the second, same thing, third, respond as well. And then at the end, we're going to have, hopefully, if we can stay on track, we're going to have about 25 minutes or so for questions that are in the Q&A or on Facebook, and we will try to get those answered as best we can. So with that, I want to begin with our first question, which is what are the current impacts on youth, young adults and their families, and to the extent that we can tell at this point, is there a different impact on historically marginalized groups or communities? And I'd like to ask DAPHNNE Brown from Families Together to take that question first.
Good morning, everyone. So I think the current impact from the pandemic is really causing stress and anxiety for families. But I also think that families are having the opportunity to interact differently with each other. You know, prior to the pandemic, families were busy. They were going out, they were working, and, you know, there wasn't a lot of time to spend with your kids. And I think this pandemic has really brought families closer. I think as far as families who have children with a behavioral health challenge, I think it's been a challenge to get services. I know not all families have the technology to be able to do telehealth appointments. I think some of the parents did not understand how to use certain technologies like Zoom, Facebook chat, Messenger. But I think, you know, the young people have helped their families to really kind of be able to make contact with the providers and to keep the conversation going when it comes to their child's behavioral health. I think for young people, I think that they struggle to find places in the home where they could actually have these private conversations with their providers. So I think it's been a struggle for them to really share how they're feeling. And I think even with school, even learning Google Classroom, I mean, we had to get on there, we had to interact with the teachers, we had to teach our children how to do their homework, and all those types of, responsibilities that children have for school. The teachers have been great with keeping in contact with parents, and I think it's been a very positive experience. Even down to seeing children do gym activities with the gym teachers in school. So I think that was good. But I think overall, families are afraid. I think they're worried about their income. They're worried about not even having their basic needs met. Some families didn't even know how to file claims online, apply for certain benefits. And I think people were just in a place of not knowing whether they were going to be able to survive this pandemic. I think the other thing is that families are experiencing loss, and I think they haven't had time to grieve. And I think that that's going to be an issue going forward. There was a lot of people who lost their life during this pandemic, and families are going to have to find a way to grieve, this process, because they weren't able to say goodbye to their loved ones. And I think overall, people are just really afraid. They don't know what's going to happen. People lost their jobs. There are many factors into how families are functioning around this pandemic because, the answers were we didn't have the answers. And, we lost contact with friends, colleagues, coworkers, and, we just don't know how people are doing. But we did come close. Families did become closer as this pandemic stretched out. And lastly, I want to say that I believe that families are really anxious to start their lives back. And I think the uncertainty around how things are moving forward is really a place where people are really anxious about how do we go back to living in this world and not being suspicious of everyone that we come into contact with. So, but I think overall it was a good experience. It was not a good experience, but it was a good experience for families to become closer.
Great, thank you, Daphne. I think that I would like to give that same question to Yo Jackson. Yo, if you could answer that, that'd be terrific.
Sure, absolutely. Good morning as well, and thank you for those great comments, Daphne. I agree with all of those really good points. I think, my view on this, as I think about how to interpret what is a global collective trauma, right? So this is unprecedented for everybody, really. And so when you think about traumas in general, the best way usually to predict how someone's going to manage this or what the current impact will be or the likely impact is to get a sense of how you were doing before it happened, right? So the tools that you had, the resources that you had before something happens says a lot about how you're going to do when the thing happens. So I think we have to be careful, first of all, to not overgeneralize, right? So, sort of to Daphne's point, not everything has been bad. And there's a desire to want to paint this in some ways as all overwhelming and all really super challenging and all negative. And it may be counterintuitive in some ways to think of this in some ways as a good thing, either now or in the future. But we need events, we need experiences, we need challenges in order to grow. The problem here is that this is so many different levels of your life that are potentially impacted. And so it's not unique to an individual, right? So it's not just something that happened to mom. It's not just something that happened to dad or just the family. It happened to your friends. It happened to your school. It happened to all the services that you experienced before. So I think it's important that we take stock that every family is different. Every child is different, and that we have to think about what their unique experiences is relative to how they were doing before. So we can do some good predicting. If you didn't have a lot of bandwidth before, if your family was already at the limit of stress, well, this is really going to leave a mark and probably much more likely to be long lasting. But if you weren't, right, somewhere on the other extreme, then you're finding creative and unique ways to manage this. So I think that we have to want to take an individual approach. We have to want to ask those individual children, individual families, and not make too many blanket statements that because you are X, like for example, because you are low income, that you are absolutely doing worse. Well, I don't think that's probably as accurate, because it denies a lot of the internal strengths a lot of those low income families actually have to navigate things. Not suggesting that they don't need support, but I'm just encouraging an individual approach. I think we also have to appreciate from a child's perspective. As a child psychologist, I can't get away from this. It's the lens that I look at of all of the time. We know that from a healthy standpoint, what really helps kids, what's required for children to be healthy is routine. They need routine. They need to know what's going to happen. They need things to be predictable, not just when they're 2 and 3, but as they get older as well. They need routines. And if this pandemic has done anything, it has disrupted everybody's routines, right? So nothing really is the same as it was before. A little bit, but not really, right, for some folks. And so I think we have to appreciate that impact mom, dad, the whole family, right? So if mom and dad's routine is disrupted, the child's routine is disrupted, then you see a tremendous amount of risk for lots of mental illness, development, difficulties and stress with that. So I think we have to appreciate that the core thing that we need in lots of ways to be healthy has been disrupted. If we can just acknowledge that that's what's happening, then I think that's really going to help us interpret our behavior next. What's also happening as we cope with this is that relationships are changing, dynamics are changing. So whereas having your children around might have been fun before, now having your children around is an interruption to your work day because you're working from home if you're lucky enough to be able to work from home. So we have to be careful too about how those positive relationships are being shifted maybe to more negative relationships because of mom and dad's limited abilities or challenges that they are also having to navigate. Let me also just mention too that we have to appreciate that, very much to Daphne's points, families are trying to function with less in every single way. So social interaction is less, or at least less. Even if you do it electronically, it's still less, right? School interaction is less. Demands on students are less. The connections that people have are less. There's a lot of loss. Not to mention the family members who are passing away, the friends who are passing away. So there's material loss and relationship loss. These are a lot of things for folks to have to navigate, right, at the same time. So I think it's important to appreciate that what is happening to families is normal. That is, the not feeling okay is normal. The irritation is normal. The sadness, the anxiety. I think it's important for us to appreciate that that's happening at large and small levels to everybody. Some folks are able to manage it a little bit better than others, but there's also a sense too that this is what happens to the sort of human animal when big things like this occur. So we have to be careful too to appreciate what the new normal is also likely to be a higher level of mental challenge, right? But much more likely to have mental illness developed. If you, before the pandemic, were at risk for mental illness, or at risk for high levels of vulnerability, you have increased that much more likely, right? So we also have to appreciate that folks who are navigating fairly okay are much more likely not to be. Let me also just mention one marginalized, perhaps, group, particularly which are kids who are already in the system relative to things like child maltreatment, for example, or foster care. We have to appreciate that there are some specialty groups who were already operating with so much less and who were desperately needing to be connected in the resources that they had. And the surveillance of those children has now decreased dramatically, right? So the systems that were in place to make sure that these super at-risk, let's say, children and families were supported have dropped out for the most part. So that's something to also bear in mind, is that there's not an equal distribution of this. So again, an encouragement to look individually at each family, look individually at each child, to really think about what the impact is. We don't want broad strokes because that does not really help us be prescriptive in terms of what families need.
Thank you, Yo. Those were some great comments. So I guess to turn it over the question to GAYLE BECK, to see from your perspective, what are you seeing current impacts?
Thank you so much for constructing this panel. It's really, I think, very interesting to hear all of our perspectives. And you're exactly right. We all need challenges to grow. One of the things that I'm seeing in Memphis, which traditionally has a high rate of poverty and a high rate of IPV, is that some of our community safety nets are starting to fail. For example, there are no openings in any domestic violence shelters that I surveyed at the end of the day yesterday. Food pantries are running low or are closed. Many agencies are providing telehealth, and as others have pointed out, that's a good thing, but it also is difficult for individuals who don't have access to stable Wi-Fi or a smartphone. Here in Memphis, there's over 5,000 evictions that are currently working their way through the city courts. And there's many more families and individuals who are facing shut-off of their utilities because they haven't been able to pay. And we are here in Memphis heading into like the harshest time of year where it's just incredibly hot and humid. So having no utilities means potentially life-threatening circumstances when the heat starts to increase. One thing that we are tracking here in Memphis is an increase in IPV exposure, particularly among vulnerable sectors of this community. People who are living in poverty before COVID started, people who were facing issues around housing or food instability, are having those stressors magnified as a result of the pandemic. I echo your concern about the potential for long-lasting emotional problems for both adults and children. We know that children have an increased risk for experiencing intimate partner violence in adulthood if they witnessed intimate partner violence as children. And so with an increase, at least here in Memphis, in IPV, I'm fearing for an increase in IPV when the generation of children become young adults. We know that mental health difficulties are well documented following intimate partner violence. And unfortunately, with the housing situation and shelter situation, there are no institutional outlets to support people who want to separate from an abusive romantic partner. Unfortunately, these impacts have the strongest effect on our most vulnerable. So, for example, in Memphis right now, the needs in the LGBTQ community are enormous, especially around housing concerns. Telehealth is actually helping in many respects because it reduces reliance on transportation. For example, Memphis has a really dreadful public transportation system like some other cities. And so being able to tap into your smartphone and have a session with a counselor is truly an advantage over needing to get to a clinic, for example, if you don't have a car. We also are seeing some people who are reaching out for mental health services who previously may not have been interested or willing to do that because of the level of shame or stigma that's surrounding that. As well, we have seen an increase in community violence during the last 2 months, which compounds the trauma exposure for people who have already experienced intimate partner violence within the home. So I think we have many opportunities for growth. I think particularly for the development and strengthening of safety nets and care systems across the country.
Thank you, Gail. Thanks for those comments. So those were, I guess, their initial thoughts on the current impact. I want to shift us a little bit now to, sorry, I'm fading out here, to what we see and what the panelists see as maybe the pandemic's foreseeable and lasting impacts on youth and young adults and their families. And see kind of what your thoughts are. I know this is obviously going to change over time, but right now, kind of 3 months into this, what do you see as maybe the lasting impacts on youth? And I would turn that first over to Yo.
Okay. Yeah, it's important to try to plan, right? If you can, try to forecast a little bit of what we can see. And it's a weird way. It's weird to say that there's some good news in that. We know a lot about what's likely to happen, not because we have experience with this particular thing, but we know what risk does, right? There's some very obvious risk factors going on. And so I feel better, it's a weird way to say it in some ways, about the future, only because there's less about this we don't know from a social science sort of standpoint, right? So as Gail was pointing out too, when you know that interpersonal violence is increasing, where child maltreatment is increasing, when people are much more stressed out, the reactions to those things, the impacts, the marks that those leave are not unpredictable, right? So that's, I think, important for us to bear in mind. Let me also just say that if we just assume that people don't get lots of services, that we don't figure out a way to really provide a lot of services, let's just assume that we don't do as much as families need. If we just sort of let things go the way they are now, I think it's a couple things that we might appreciate here. First of all, there will be some positives, meaning that there are things that are happening that are bringing families closer together. To Daphne's point earlier, there are people learning more about their children and discovering more about their relationships. So there are some of those things happening, or finding ways to be much more industrious or creative, right? We've been inspired by some of those examples in social media of how people have really tried to move forward in lots of interesting ways. However, I think it's also really important, if we're going to talk about kids and families, that we all remember that children, by and large, cannot be more regulated than their parents. So it often seems counterintuitive to think about it this way, but we really, if we want to help these kids, we have to help these parents, right? Maybe that's not counterintuitive, but a lot of times we focus almost exclusively on how ill is the child or what's the risk for the child. You can do a lot to mitigate that risk if you asked, how is mom doing? And how's dad doing? How's grandma doing? How is the caretakers doing? Because as a child, you really cannot push beyond the ceiling that your parents set for you in terms of mental health. You really can't. And maybe when you get older, you have some capacity to do that. But really, we want to think about this as a dynamic. It's really not something that happened to the child. It's something that's happening to the family. It's something that's happening to the community. So I think we have to appreciate that taking the temperature of the health of those systems is likely a good way to forecast what's going to happen. I also, whenever I get a chance, I always try to remind folks, whenever we talk about trauma in children, to remind folks that children are not resilient. That is probably one of the most dangerous sayings I think I've ever heard. This idea that children are some sort of superhero, or they're made out of rubber in some ways, and that they are resilient. They're not. They're the opposite of that. They're actually really absorbent. That's not to suggest that children can't overcome things, but they don't do it alone. And that's the dangerous part of that saying. It sort of suggests that it doesn't take a community of people to make that child strong. Children need support. So we don't want to get comfortable with the idea that, quote, Reggie seems fine. We don't want to do that. We want to be careful not to overestimate the fact that because he seems okay, that he is okay. That's a big mistake. So we want to be careful about that. And we have to think about really making sure that the caregivers are calm and safe and secure as much as possible, that's going to go a long way to making sure that children are doing better in the future. So for those parents who are, quote, adjusting well or have supports and resources or are able to access those things, we can forecast very easily that their kids are going to maintain a pretty stable trajectory. That's going to be a good thing. We could probably learn a lot from those families in terms of what they're doing or what's making a difference. However, in those families where the stress is very high, where the resources aren't there, where they're not able to navigate this very well, or frankly, the hits just keep coming, right? Where it's a job loss and then a loss of a family member, right? And then we have to move, or that we have food insecurity. When those things just keep happening, right? And we're not able to get on top of that, what really happens to kids is the development of a really unhealthy pattern of coping, this sort of fight or flight. Fight or flight is supposed to work when you are in extreme danger, right? That's what your body's reaction to keep you safe is, to run away or to attack it. And instead of that being an emergency valve that goes off, when kids are exposed to chronic things like this, it becomes a chronically pressed accelerator, right? So it's always on. That has significant physiological impacts on a child, right? Makes them much more likely to have heart disease, much more likely to have inflammatory systems and processes in their bodies. So biologically, they're impacted long-term, something, again, you can't necessarily see on the surface. And they're also much more likely to have challenges engaging with friends, making new friends, focusing in school, being able to navigate the regular demands of being 10, right? Or whatever it might be. They will fall behind developmentally. So those are the kinds of things that we're going to be looking for, is the kind of fight or flight or adaptive process, if you will, that these kids are experiencing. What are you noticing, right? Might be a good question in those kids. What are you noticing now? And can we interact or impact those sort of processes now? I think is really, really important. They will grow up to continue to see the world as a threatening place, right? That even benign interactions are things you have to be concerned about. And so I think it's important that we just start that assessment process now and really think about keeping regular tabs on how our kids and families are doing. Again, maybe counterintuitively, starting with mom and dad and any other caretakers, really taking their temperature as a way of really getting ahead of our predictions for how the child is doing.
And it's sometimes counterintuitive depending on your role, right? Going to the parents first versus always focusing on the child. To address this question as well, now I'd like to call on GAYLE BECK to give us her thoughts on kind of the foreseeable lasting impacts on youth and families.
Certainly. Yo, I've never met you face to face. I don't know if this counts as face to face, but I have a feeling we could have hours of fascinating conversation.
Yes.
I share your concern about the potential for mental health impacts. I like to, when somebody asks me, what's going to happen in the future, I like to anchor any answer I give in data, preferably recent scientific data. And just recently, several investigators did an analysis of data that was collected in April of this year. So the pandemic was well underway at that point. And part of what they found is that adults in the United States were 8 times more likely to fit criteria for some form of serious mental distress. So the rates were around 28% in adults in America, and 3 times more likely to fit criteria for either moderate or serious mental distress. So there's a lot of distressed adults in America, and if they're distressed, they tend to have high levels of distress. And the thing that's particularly concerning to me is that this distress is especially noticeable among younger adults, people who are ages 18 to 29, and importantly, people who have children in their household. So part of what this makes me concerned about in terms of mental health issues, when I think about intergenerational patterns of violence and trauma, is that children who are exposed to violence in the household when they're little have an increased risk of being exposed either as a perpetrator or a victim to intimate partner violence as adulthood. You were cogent and right on point when you were talking about unaddressed mental health needs for parents. And, we know that we have time-limited and fairly effective treatments for a variety of mental health issues that can evolve following trauma exposure. We also know, and I think this is hugely critical, that if you work with a woman who has post-traumatic stress disorder resulting from violence in the home, and you treat her effectively, that she's less likely to become involved with another romantic partner who's violent or abusive, which to me is a huge part of the link of breaking that chain of intergenerational exposure to violence. The problem comes in when, as a mental health professional, we start thinking about how do we build sustainable networks to provide mental health services across the broad spectrum of individuals in this country, especially for folks who are in low resource communities. I don't even know if we have enough trained mental health personnel, for example, to address this population. But I do know that there are some investigators and some clinicians who are thinking more and more about stepped care kinds of processes. A colleague of mine at Rutgers has put forward some sort of self-management online modules for children and youth that are designed to help address issues around anxiety and depression. These resources conceivably could be oriented so that youth can access them whenever, either via YouTube or a blog, and then have a series of professionally trained coaches who can reach out to youth, children, their parents, if emotional issues are not reducing as a result of self-management types of things. I asked myself, is there any way we could do this on a national level? And I think there probably are. There's some hurdles we need to think about, things like state licensing laws and malpractice concerns. None of these are small concerns. I don't mean to minimize the impact of some of these issues, but we also need to think about creating an infrastructure to support that. At the same time, I'm aware that when there's violence in the household, one part of the dynamic of violence in the household is that the perpetrator often reduces contact between his or her partner and their social network. And so there's going to be reduced help seeking, which is part of what we've been seeing in Memphis. If you're locked down at home with an abusive partner, there's reduced services at some agencies. You've got gaps in your available technology, and you're horrendously ashamed of the circumstance you find yourself in. We have a bit of a perfect storm for people who may be reluctant or unable to reach out for assistance. I think as a mental health community, we need to think about working to increase social support, especially for marginalized components of our communities, constructing, for example, Zoom support groups, ways to strengthen parenting skills, ways to help people who are trapped in the home where there's large levels of stress and potential violence that's going on. I think as a community, we can't just put it all on the individual. We need to build stronger safety nets. Here in Memphis, at least, we need to have stronger laws against DV perpetration and more consistent legal sanctions against repeat offenders. In my research clinic, we have seen over time women who come in who are involved with the same perpetrator, and there's been little or no sanction on that abusive partner over time. And clearly, I think we need to strengthen our resources that address food and housing instability right now, because there's only so much, no matter how resilient you are, there's only so much that anybody can creatively cope with and manage in face of numerous challenges.
Thank you, Gzhel. And now I would turn this question over to DAPHNNE for her response on the, what do you see as foreseeable lasting impacts on youth and families?
So I feel that the service industry, it really has created an opportunity for families to really think about how they want to receive services. Instead of the traditional going to the office, families now have a choice to receive their services via telehealth, text, phone calls. And I think it has created relationships with providers to really get in there and to guide families on how to be there and how to support their young people. But I also feel that another lasting effect is that it has just really increased the fear and anxiety in youth with behavioral health challenges. I know for children, youth involved in the juvenile justice system, with probation, it really gives probation an opportunity to look at how we engage young people involved in that system and to seeing how we can better support them based on what they need, not always being so punitive and having them report to us, but reaching out and meeting families and youth for where they're at. I also feel like, I think the job insecurity is going to be lasting. But I also feel like youth have got a better understanding about what they need going forward and, can really start to speak up about what they need. Because when they have to do the telehealth meetings, youth had to kind of step up and take charge of their own treatment because some families did not understand how to use the technology. So I think that will be lasting, that youth will be more responsible, in stating what they need and what they want to help them with their behavioral health challenges. The other lasting memory, and I think it's just really important, is, the young people that graduated in 2020, we supported them. They were on TV. I thought that was incredible that, in Monroe County, I could see all the young people who graduated. And for them to have that memory of being celebrated by their entire community. Let me see. So, and then also, youth have learned that they have a choice on education also. A lot of times young people did not want to attend school. They had anxiety. And so school came to them. This has really opened up opportunities for youth to really decide you want to graduate. And the school has to recognize that this young person did what they needed to do and they finished their work. They graduated. They passed their classes. So we really have to, start looking at, what was successful during this pandemic, because there were families that have been successful as they navigated this uncertainty. So.
Thank you, DAPHNNE. We happen to live in the same community, and I saw the support of those kids. It was amazing, and nationally seeing the feed on how kids are being celebrated for that high school achievement and graduation when they otherwise probably wouldn't have been, which is really, really nice.
Right.
So if I could turn it, we're doing good on time, which is great. Turn it to question 3, which is kind of, we've talked a little bit about it so far, but what are the stakeholder innovations developing in the community among your partners in your field, and what impacts are you seeing or expecting? And I also would add to this a little bit and say, maybe do we have the ability, what innovations are we seeing, and are there gaps we're missing? Like, for example, you guys were talking about loss in the first question, and I just wonder if some providers will even recognize that as an issue. So if you could speak to that as well, if there may be gaps where we need innovation, where we're not seeing it, maybe speak to that as well. And I would start this off with GAYLE for responding first.
Thank you. I think this is a moment of crisis, which translates into a moment of tremendous opportunity for us to be creative both within our community and nationally. One of the things that has been evolving over the last month or so in Memphis, which I'm grateful to be involved in, is increasing the dialogue among the LGBTQ community about mental health needs, especially in young adult and racial minority members of the community. Several of us are planning to put a needs assessment together, in part because mental health folks sometimes go rushing in with services without having any idea of what the community perceives as their needs and what they want in terms of services. Part of our program that we're developing is to provide training resources to improve competency among mental health professionals in working with this very vulnerable sector of our community. And we've been brainstorming ways to try to develop something that is sustainable over time. We're seeking grant support to get kind of the initial initiative off the ground, but then we need to think about ways that whatever systems we evolve has its own legs. So it's not just contingent upon getting grants and in order to exist, for example. Another thing that I think is essential, remember, I live in the South. I haven't always, you can tell by my lack of a Southern accent, but in the South, the faith community plays an extraordinarily important role in terms of Southern culture. And my group has been spending a lot more time reaching out to leaders within the faith community. Most of our churches and synagogues and mosques have not reopened, but many of these organizations have started doing online church or online faith services. And many times a faith leader is somebody that a youth or a young adult may reach out to in terms of getting assistance for any form of emotional stress that may be going on. I think as service providers within the larger network nationally, I think we need to develop our open communication with a wide variety of people that folks seek out for help. You know, that could be hairdressers, that could be bartenders, although the bars are not open yet for many of us. But I think that there's a number of folks that people reach out to for help who are not mental health professionals. And so increasing that dialogue, increasing that channel of communication, I think is really, really important. One thing that I've been seeing a little bit in terms of our discussion, at least in the South, is talking about ways to change our shared relational norms for what's normal within a family, what's normal within a romantic relationship. Before the pandemic really hit and schools were closed, we were starting to see some schools hosting what I would call like relationship 101 kinds of classes for middle schoolers. And they were often led by DV advocates in our community. So thinking about ways to develop a new dialogue around what is healthy within a family. And if it's not, you know, when you're a little child, what is normal is what you assume everybody experiences because that's the crux of the majority of your experience. So thinking about ways to help emerging adults, middle schoolers on up, learn a little bit more about healthy communication, problem solving, some of those key skills that are important, especially when stress increases. And optimally, we need to extend this dialogue to parents as well, because I think that reaching parents is one of the ways that we can start to interrupt intergenerational cycles of abuse and violence in the home.
I would turn that this third question over to DAPHNNE. You know, what are the innovations you're seeing and in your field, and what impact are they having?
Okay, I think providers of children's service systems, I think that they have had to really increase their knowledge on how to respond to families in need of services due to the pandemic. And they've had to think of creative ways to engage the youth, you know, with an emphasis on getting to know who they're working with and what they need. As far as the providers, you know, going forward, they have to think about how they're going to get these providers trained in order to serve the community and the families in need. So they're going to really have to really think of a way of how to really bring it all together so that people will be able to serve families going COVID forward. I think this is an opportunity for the stakeholders to look at how are you going to allow families to choose the services that they want and how will they be delivered. And not overburdening families with multiple people coming to your house and, you know, multiple providers calling you, but they're going to have to work together to meet the needs of families without overburdening families. Because I actually read something where sometimes families are like, well, just hang up or not answer in the middle of a therapy session. So they're going to have to be creative in ways and give families doses of the support they need without overburdening them. I think it's a good time to really start talking to families about what they need going forward and really understanding and helping families to understand how it is they can support their youth during this time. I think families have more time to learn about the needs of their children, and this is a good time to really give education. And I just think that they're just going to have to learn to do business differently, and they're going to have to do it based on the community and what each community needs and what that family needs. And they're going to have to look at the family's culture also. Not just going in, doing services and delivering services the way that they would like to, but how is the family going to receive this and what's actually going on in that community? And how can you, in doing all this, how can you help that family and based on what they need going forward and who they are as a family? So I think this is just a good time to rethink our infrastructure in New York State and how we're going to do things going forward if we're going to continue to serve families.
And the final question, question 3 again now to Yo for your response on that.
Okay, can I just say I'm really enjoying this conversation. Like, this is so important. I feel like I'm learning a lot. And I want to echo the comments of my co-panelists, because I just think that we talk about what's happening now, how we're adjusting. It's important to look at that, right? To be assessing how we are responding. I will tell you, you know, I can echo too some of the comments made earlier in that I see a lot more efforts by community agencies to, you know, reach out to families, provide support, education, mental health, general information. You know, goodness gracious, I don't know how many times we've been told to go check out the CDC's website, you know, something probably no one had done before. The CDC has a website, they actually do, and you can check it out. There's a lot on there. But so like people are getting information, and I think that that's good. I'm seeing efforts to make, you know, almost every place I go, I see references to some sort of COVID update. Everybody in my field seems to be creating some sort of link, online resource, right? Ways to help your kids, ways to help parents, ways to do this or that, right? There's a lot of efforts, I think, by the community of professionals to want to provide some resource, whatever that might be. Universities are doing it. I often question, so Penn State, for example, put together, of course, their package of COVID resources, and you know, every university is putting together their package, you know, for employees, for students, for the general public. So I see that, right? That energy is really good, really positive. I think that's important. A lot of policy briefs. I'm also seeing people at the state and federal levels of legislature doing the same thing, wanting to try to also put some money behind those things, right? So not just information, but also trying to create pockets within all of the relief packages. There's been a big push to make sure that science and make sure that mental health, especially for perhaps what we might call marginalized communities, get their extra, right? That they really need extra. So if we were providing services before, now we need extra money to make sure that we really provide lots of services for, say, for example, kids in foster care. Making sure that we're doing that. So it is on the mind of key turners, you know, as well as folks on the front line of this, is how we can do what we do before and make sure that the service is effective, whatever that might be, you know, basic needs as well. I think one thing to bear in mind here too, though, and we talked about gaps, or where we might also have some gaps. And I do think we need innovation. I think for me too, what I'm struck by is how our default, for the most part right now, and this may just be my limited view, is really around technology, right? Which makes some sense. If we can't leave our houses and we can't get together, then really all we have is the internet. That's really our default for how to access each other. And it's really been a great tool in being able to do that. But, you know, to some of Daphne's points too about some of these families, I think we have to remember that a lot of the folks who are making these briefs, creating these links, creating these resources and such, are people who are very comfortable with the internet, are people who are very comfortable with their phone, very comfortable with technology. And I just want to ring a big loud bell to say not everybody is, right? Everybody in your circle, of course, knows exactly how to do all kinds of cool things with their phone. But I'll tell you right now, there's a huge swath of this country that is very rural. That doesn't mean that they can't do these things, but they're just not the same level of internet access in the country. There just isn't. You can't be as facile as folks can in Chicago with internet access. If you live south of Chicago, right? Like if you live in the middle of Illinois. So I want us to be careful not to disenfranchise a whole nother group of people, because every single resource requires a hotspot or an internet connection, right? And a good internet connection, right? And a consistent internet connection, and one that you can pay for, right? So let's also talk about the people who live in cities who can't afford these kinds of technologies, or whose technologies are variable. So for example, I work with a lot of families in the urban core of Kansas City who, frankly, their phone numbers change about every other week because they really can't hold on to that bill, right? It's too expensive to consistently have access. So I think we just have to appreciate that not everybody is this savvy. And not everybody, can I tell you, is running to the Penn State University's COVID resource page to figure out how to sort this out. I love the pride of Penn State and that they want to give that, and I'm picking on Penn State, but you know, it can be any place. But I don't know, the families I work with don't all run to the internet to solve their parenting problems. I think a lot of my friends do, but I don't think a lot of other families necessarily do that. So I think when we talk about rethinking infrastructure, that's such an important point. Because I don't know, I get why we do it. Nobody's saying it's a bad idea. It's just not the end of the conversation. Putting up a resource online is a start, not a conclusion. And so I think we have to be appreciative of that fact. Also, not everyone has the same language capacity. So reading really long lists of resources is overwhelming. So that's one of the things I see as sort of a gap, is that, you know, us academics particularly love to just pepper people with tons of facts and lots of ideas and bullet points. We love to do that. But I got to tell you, not everybody receives that as a good idea. They're actually overwhelmed by that, and they really just need smaller bites. I think we have to, so I guess I'm trying to embrace in some ways the unpopular view, which is that not everything translates to being online. I get that we're doing that. Our clinic here has put everything online. But we don't know how good that mental health treatment is, for example, right? We don't know. And you're absolutely right. People disengage from it all the time or feel like it's too much trouble. Meanwhile, their mental illness is still cooking, right? Their stresses are still cooking. And yet that's really the only thing we've come up with at this point. So I want to encourage us to really rethink this in a much bigger way. In a lot of ways, you know, I'm trying to think of a metaphor that would make sense, but I feel like putting everything online and leaning so heavy on tech is like asking everybody to speak with like a British accent all of a sudden. Some of us probably can do that, right? And pull it off pretty well, but some of us can't. And I think it's important that we appreciate those that can't. So as we move into the next phase, right, from online, which was a good set of solutions, we have to think of what else we can do. What's a safe way we can engage folks? Because I will tell you, I'm not convinced that we have a equitable substitute for in-person contact, especially when it comes with children and families. I don't know that the approaches we're using now are going to be sufficient. So that's not meant to be a criticism. It's just meant to be an encouragement to say, okay, so what would it look like if we needed to educate parents about how to take care of their kids? Well, maybe we need to find safe spaces. How do we create safe spaces? We need key turners to provide funding to create those safe spaces, right? We have to think on that level of what we would really like to see, right? A safe place where families could go to learn about how to manage their stress, for example. I think it would be great. Not everyone's going to do that online, and not all of the online is going to translate and get absorbed. So I would really encourage us to be thinking beyond the technology, in addition to the technology, so that we're able to reach those folks that frankly, right now, I think are automatically cutting out. If you have a mental health problem in the middle of Kansas, I guarantee you will not be able to find a quick and easy internet way to sort that problem out. And that's now compounded by, the pandemic. So my encouragement there is just to really be thinking about and encouraging our agencies. So for example, in foster care, we're trying to think about ways that you can still track and surveil those families. Because I'll tell you right now, doing it online is not a great way to track and surveil risk in a family, right? You really do have to do home visits. You really do. And so we have to think about, how do we do safe home visits? What does that look like now moving forward? So those are some of my thoughts and maybe some encouragements as we shift and grow in our skills in this area.
Thank you, Yo. That was great. It's interesting. I've been on several panels over the last couple of months, and it's I think a good warning. Not warning's maybe not the right word that you said about not putting all our eggs in the basket of technology, because a lot of people they are reaching populations. What I'm hearing that they may not have reached before just because it's easy. But you also, having grown up in a rural environment near Kansas City, I get it. Like you. There are places where it's not easy. Yeah, so thank you for that. We've come to the end of all three of our questions. And so I think we have plenty of time, I think, to take questions. So if you could put them in some people already have, put them in the Q&A section. And I thought maybe we will kind of turn our attention to this and we'll go through the questions. Some of you have directed them to specific speakers, which is great. And if not, what I'll do is read the question out and see if one of you guys want to take it, or maybe I'll direct it to someone first if I think maybe it should go to you. I think the first one is for Yo. It says, Dr. Jackson, I found that what you said about children and resiliency very interesting. The idea that children are resilient is something I hear from educators frequently at work and trainings. Why do you think schools, especially those who provide care for children with trauma, perpetuate this idea?
I tell you, it's such a frustration. Right, great question. Right, I think my first reaction is a little bit snarky, so I apologize. But I think it's comforting. I think the reason that we often want to think of children as resilient is it makes us feel better. Don't you want to think your kids are okay? Don't you want to think they're not hurt by all the things that are going on? And I think too, there's a less snarky answer is perhaps, I think there's a basic misunderstanding that really is a historical one, which is that early on in the world, we tended to think of children as little adults. Right? We thought they were just shorter versions of ourselves, that they were able to think like we did and function. That's why we put them in factories. Surely they can work. What's the big deal? We've shifted that. So it's still a little bit of a remnant of that idea that they're just smaller versions of us. So if we're playing and goofing off, we couldn't possibly be sad, right? We see kids, for example, at a funeral will be running around and you think, wow, he's coping so well. That's not what that is. So, because if you were running around and playing, you would be doing fine, or you're getting a divorce and the kids, quote, don't seem all that upset. So they must be resilient. that's just a misread of child development, basic child development, and a misread of how children function. They're not. I think it gets us off the hook, frankly. I'm back to the snarky answer. It gets us off the hook in some ways to think that kids are resilient, because then we don't have to do as much, right? I don't have to do much because kids are resilient. He doesn't, quote, understand. Even your dog knows when you're stressed. Can I just say that? Like, even your pets know when you're stressed. Your children know when you're stressed too. They know when things are not okay. What they don't have is the cognitive capacity to say it to you, or explain it to you, or show it to you. They're not speaking your same language, right? Children speak a somewhat different language depending on how old they are, how they communicate things. And we're not always good at reading it. So we, I think as a default, like to think of kids as resilient. They seem to be strong. What we know about resilience is that it is complicated, and that it requires more than Reggie's individual abilities to do it. No child recovers from trauma by themselves. There's just no evidence for that. Absolutely not. We like to make movies about these things, right? We love that story, right, of the person who overcame despite all the odds. But I guarantee you, no one overcame despite all the odds by themselves. Most people who are facing odds end up homeless, unemployed, substance using, and incarcerated, right? So that's usually what happens, because that's the natural trajectory for humans. So I think in some ways it's a little bit of get out of work free card for systems like school systems. It always shocks me a little bit though, whenever I hear folks who are supposed to be working with trauma saying, oh, by and large, kids are resilient. They're really not. There's just no data to support that. So I always try to encourage folks not to think of children as victims. I mean, that's not necessary. It's just that children operate in systems. They need networks of supports in order to, quote unquote, be resilient. Oh, I think, go ahead, Gail.
If I can add a little bit on to what Yo just said, I don't pretend to be a child clinical psychologist, but as much as we have this myth that children are resilient, we sort of have the flip side that somehow adults are highly vulnerable. So children are expected to be these little bulletproof, smaller versions of ourselves, as it were, but we regard adults as much more vulnerable. And in actual fact, part of what we see when we look at trajectories after trauma exposure is that depending on the severity of what happened to somebody, by and large, like over 50% of adults who are exposed to traumatic events after an initial bout of not being okay and being distressed will recover emotionally. And so it's just sort of really curious, maybe I could say bizarre, that we think children are resilient and adults aren't, when in actual fact, I think the data are a little stronger for adults being a little bit more capable of managing, coping. And, you know, I would expect that after you've grown up a little bit and learned some coping skills and learned how to communicate, and you know, so that we have these cultural beliefs that aren't necessarily driven by what actually happens.
Good point.
DAPHNNE, do you want to respond to that? If not, I'll move on to the next question.
I feel that kids do recover with the right support and the ability to be able to express themselves. So I know that our organization, I've always heard that resilient, and I've never questioned it. I've more in turn think about kids being able to recover from whatever they go through and what has happened to them to grow up to be successful. So
I have another question. This one I'm going to, this one's for DAPHNNE. It just says, you know, as your agency provides the high intensity wraparound services, what are the needs and challenges you and your colleagues are seeing among the families that you work with as you move towards reopening?
So our agency doesn't provide wraparound. We train family peer advocates and youth peer advocates to provide wraparound services. Typically, families that come into wraparound have started out in the children's system, and they tend to penetrate it further if their needs are not met. What we're seeing is that families are reaching out. They're connecting with their providers. They're talking to their care managers. They have been creative in meeting families, even going outside families' homes and dropping off food. So we see families really engaging more because prior to COVID, families, you know, the process of wraparound is just that, a process. It's not a service. It's a process that you take families through where you have the conversation with them. So what have you tried and what else would you? So you have to try stuff in order to sell, unfortunately. But in wraparound, what it is, you have a plan of care that is created based on things that have not worked for you. And you try to be creative in connecting families with community resources that will help them not further penetrate the system and for children not to be removed from home. So they're more engaging.
Okay. I guess it says this was asked for Yo, but I would ask if you all have if GAYLE or DAPHNNE have responses as well. Can you elaborate on LGBTQ youth and how they are being affected during this time and how they can be helped?
Sure, right. So I think that it's an interesting question because I think what is happening for youth broadly, right, in terms of loss, change, transition, right, those kinds of things, adapting, is almost always heightened for populations that have any kind of special need, right? So I think that the degree to which that individuals were able to connect with the community, for example, and can't do that anymore, or feel more isolated, because you know what we see, especially with young youth in this population, is the sense of isolation, a sense of lack of connection with other people, and not a sense of sort of confidence and safety. And I think that what we're seeing in this population right now is similar to what we see with other, I keep trying to say not marginalized because I don't like that label, but the subgroups, I don't know, additional groups, unique groups, important groups, is also a disconnect from community. Now, that said, there's also, for those who are tech savvy and for those who are connected, whose connections might have also been very much driven by social media, we may see no differences at all. We may actually see very little uptick in a sense of loss, disconnection, and change. But for those who are not, for those who are not in community, for those who are not feeling support, again, I want to go back to the point of how you were doing before says a lot about how you're doing now. So if you weren't super connected before, if you didn't have those supports in place, those friendships, those connections, then you're feeling that 10 times more, right? You're feeling that exacerbated. So I think that what we have to be aware of is that for any one group that relies consistently on a sense of community so as to not feel threatened and safe, that's likely being significantly challenged right now.
Okay. GAYLE, go ahead.
Part of what we're seeing in Memphis, and it kind of goes back to something that we've been talking about off and on, is that for folks who live in the city, those sense of connections have been established and are already there. The people that are within the LGBTQ community who appear to be struggling the most are individuals that live outside of the city. You know, Tennessee is a fairly rural state, and we are seeing a number of LGBTQ youth who live in little towns in the middle of Tennessee who are truly struggling. We're calling crisis numbers in Memphis, for example. And I think when I start to think about how we address, I don't know, underserved communities. I'm with you, Yo. I'm not a big fan of using the term marginalized, but underserved communities. I think that's where kind of building that infrastructure is so essential. And for all services, like optimally a wraparound network that provides a sense of connection for all individuals who are in vulnerable, underserved communities.
I will move on to the next question. Actually, Gzhel Lopez has a question, so I'm going to have her ask it.
Thanks, Amanda, and thanks again for this insightful discussion. When we came up with the idea for this forum, we sort of happened upon a catchy title, but a misnomer. Are the kids all right? Whereas all of our discussions here wrap around 3, at least, different stages of development: kids, the teens, and emerging adults. So my question to you guys is, what are the unique needs and challenges of these different age groups, and how can we meet them, especially if we keep in mind social distancing and the supports that each of these different groups have come to rely on pre and during pandemic? Thank you.
I can start us off if you like. I would say that what's really important, if you want to understand the scope across childhood, if you will, across youthness, is to understand development, right? So what is the developmental demand of, say, preschool versus school age versus adolescent versus young adult? Each one of those, and those are just broad categories, has a different set of developmental tasks and expectations. So for example, the impact on young adults has been mentioned already, but those folks who are expecting to transition into adulthood in ways that are really obvious, like transitions from school, right? Or moving out or getting jobs, all of those things have been blunted. Or shifted dramatically, right? What it means to go to college right now is dramatically different from what it was in January of just this year. And what it's going to mean in the fall is very different as well. So they're facing, I will just say, the young adults, particularly facing challenges about what they're supposed to do now, right? How are they, the pathway, the prescription that we've laid out for them in terms of how you're supposed to move forward to adulthood has been stopped or halted, right, in significant ways. And I think that they're sort of raising their hands about what they're going to do. I'm noticing hiring freezes, of course, not only people losing their jobs, but there's hiring freezes all over the country. So you're going to college for what now? You know, exactly. There's questions about now, what am I supposed to do? And the challenge for those kids oftentimes too is that the adults around them don't know either, right? Like we're still trying to figure that out too. I think for adolescents, you be stepping back just a little bit, you're talking about transitions that really are about, unfortunately, social connections, peer relationships, such an important part of adolescence. Now, plenty of teenagers were on social media already, so this is not going to be a super big jump for them to do so much more online, but we're already seeing a lot of distress out of adolescents that this is not sufficient. And in fact, it is not it's actually creating some level of conflict for a lot of adolescents because they have to share their bandwidth with family members. They don't have the privacy they had before because they're doing all of this in their homes. The frustration they feel over not being able to be more independent, which is also a developmental task. So you see much more conflict between mom and dad and kiddo for teenagers because they're all stuck in the same house, which is, nobody wants that. Nobody wants that, the parent or the teenager. But you know, for teenagers, they're supposed to want to get out and go. So what this has done is it's really pulled a curtain down in front of the developmental trajectory for those kids, or at least paused it in a significant way. But that has now been driven inward into the family, and we see a lot more conflict. There was already conflict, right? Normative conflict between teenagers and their parents. Now it's much more likely to be at a fever pitch. And parents, frankly, throwing up their hands. I've spoken to quite a few parents who are just letting their teenagers do whatever because they're exhausted as parents. Yes, it's risky for you to go over to that kid's house because, you know, pandemic and social distancing, but they frankly can't do that level of guardian, and are frustrated and then scared when that kid comes home because maybe that kid's been exposed. And that's real. That's a really significant, serious thing that I'm seeing on the regular for a lot of adolescents, which feels like it's only perpetuating the pandemic. But how do you balance my strong developmental need to grow and be healthy and experience life the way that I'm supposed to, and not getting COVID, right? So, and frankly, from a cognitive standpoint, a lot of adolescents simply cannot wrap their head around the scale of this. Hello, all of the news clips of, I don't know if you've noticed that the people who are getting together at the Lake of the Ozarks and the beaches of Florida are all basically the same age. A lot of similarities in how old those folks are. There's something developmental about that, right? That it's not your Nana who's often breaking those rules. It's often much more likely to be your 17-year-old or your 21-year-old.
Daphne or Gayle, do you have a response to the Jesus question?
I agree with what Yo said. I think that young people just want to break free. I think families want to be confident that they're making the right choices for their kids. And I think young people need to really start to experience some success. And they need to have hope that things will go back to, whether it was good or bad, things will go back to normal. But I agree that young people really are not getting the seriousness of this pandemic, and you see them doing risky things, and just because they can't meet up with their friends, and it's like you see them and they've forgotten about the pandemic. All of a sudden, it's just like it's a free fall, and everybody's out in the community, and and there's no way to meet the needs because there's nowhere for them to go. So they just meet up late at night on the streets in Rochester, and it's just scary. It's really scary, but they need to have something to look forward to. They really do.
I think that's an excellent point. Having something to look forward to is, I think, really important.
Gayle?
Mm-hmm. One thing that I've seen being surrounded by emerging adults on a university campus is that there seems to be sort of a view on COVID that's either all black or all white. So it's dangerous. I have to stay home and, have food left at my front door, running the gamut to, I can't do this anymore. I'm going to go hang out at the park standing right next to my friends. And I agree that sort of part of growing up is learning that everything isn't all good or all bad, that there are shades of gray. And I think that the provision of hope has to be filtered through the perspective of, there are ways to be social and be safe. There are ways to return to work if you had a job and you still have a job, that you can protect yourself and others, maybe not working the same number of hours, maybe rethinking that career trajectory that you've been in college for. I think that part of growing up is starting to learn to think in a little more nuanced way. And that's complicated, right? It's especially complicated to figure out how do you parent an emerging adult who is vacillating between locking themselves in your house and, Katie bar the door, I got to get out of here and go hang out with my buddies, right? So, I think that in many respects, providing some, opening a dialogue among parents for high school, college-aged youth and emerging adults might actually be a really helpful thing in terms of just sharing ways of helping our young adults become young adults.
Can I also add, that I think that what is slowly happening is that people are starting to realize that this is not going away. Right? Like, so it's weird. I have days where I think I'm, not connected to that notion. We are in a place where I think a lot of us are, I heard this phrase, uncertainty fatigue, right? Like, so people are just tired of not knowing. We need is sort of, to know what the answer is going to be. And there's a feeling of sort of being on hold, in some ways. I don't know that we're on hold. I think this may be the way things are. I mean, various levels will improve. Don't get me wrong. I think we'll, obviously you're going to make some strides, but I think we're very slowly coming to the realization that we actually have to create new ways of interacting and understanding. And that means also, can I just say, lowering expectations. My strongest advice really is around lowering expectations. I think there is also, I've noticed, a great harshness that parents feel. It would feel self-inflicted in lots of ways, because we can't operate at this standard we were at before. I've got to be doing everything I can to try to get us back to where we were before. And to me, that's part of that sort of false understanding of really the reality of our situation. You cannot work from home and have a 4-year-old there all the time. You're just not going to be as productive. You're just not, right? As adorable as the 4-year-old is, that's a distraction, a significant distraction that, that's very hard to navigate. So I think, and if you have a teenager, I think it's the same way too, that we have to appreciate that. I think I mean, lower expectations just in the name of being kind to ourselves, not lower expectations that we shouldn't be loving and supportive of our children. I just think we have to appreciate that we're operating on less energy, less support, and less clarity. And that means that we have to give ourselves a break a bit, and our children a break a bit. We have to lower expectations about what they are able to do right now. And I really like Daphne's point of having something to look forward to, because I think with that lowering of expectations, we also have to say, but how are we going to plan for the future? What are we going to do? What are some goals that you might have? How do we modify those? Nope, you probably can't go to college this fall exactly like you thought you were going to, right? Because if your school doesn't open up, then you can't do that. What are some other ways, though? Let's brainstorm about how we can make this meaningful for you. I think those conversations need to happen, and I think that's part of the paradigm shift, is making that a norm and not a one-off.
Thank you. I'm going to switch gears a little bit here to a question. I'm going to give this one to Gayle first, and then if Daphne and Yo want to respond. It says, as we treat women for domestic violence, it says woman, but it could be anyone we know. The person's much likely to have their children not be removed. Although we have evidence that DV has increased in homes, we also see fewer children removed from their homes, at least in this person's jurisdiction. I don't know where that is. Do you think that reduced rate of removal should continue? And do you think it will?
That's a wonderful question. And I think we've glanced off of parts of that question in this dialogue so far, where there are fewer, for example, I'm not sure if it was Yo or Daphne used the word surveillance. In other words, checking on children who are living in high-risk situations. So I think we're seeing less removing of kids from high-risk homes as a result of not being able to do all those home visits, right? How can I or anyone support leaving children in environments that aren't suitable, right? I mean, that question was, do you think that we should see fewer children removed from the home? Well, if a child is in a home situation that is potentially dangerous or damaging, obviously we need to provide some intervention. Now, is that intervention going to be removing the child from the home? Then you have the thorny dilemma of, where does that child go, right? I think we need to build ways where we're checking in with children who are living in high-risk situations. And obviously, that's where the developmental continuum starts to play a role. Checking in with an 11-year-old is a very different thing than checking in with a 4-year-old, obviously. But some ways that we can start to not insert ourselves into homes, but be more mindful and be more present in a way that doesn't burden families, but present in a way that supports children who are in really difficult situations. I know I'm seeing a comment that says it seems impossible. I think it takes more people than what we have on board right now, especially if we're going to do outreach, phone outreach, for example, with children who are a little bit older, who are capable of articulating what they're experiencing in their situations. But no, I'm not in favor of children remaining in homes that are dangerous for them.
Daphne or Yo, you want to respond? Or are you good? Okay.
I think that we're seeing that because people are using substances, people don't have anything to do and they're tired of looking at each other. But, when we talk about removing children from the home, I think we need to look at removing that adult who is the aggressor from the home rather than uprooting children. And I know a lot of women, would like freak out about something like that. But really, why should the child be displaced when the person that's actually causing all the chaos, they should be made to leave the home, So.
It's a good point. I want to switch gears a little bit and talk about school. One of the questions we have is, how equipped are schools for responding to potential and varied levels of needs resulting from COVID, and what would be some recommended approaches as schools reopen in September, obviously from your perspectives? And I would leave that to whoever would like to take that first.
Well, can I just say that there's a almost linear relationship, meaning an almost equal relationship between funding and the answer to the question. Meaning that what I have witnessed is the tremendous diversity across states, even within districts, but especially between states. How funded is this school district says everything about what efforts, systems, mechanisms, resources that they have in place. That's not surprising. That's not a really sort of sophisticated answer, but it has just been shocking, I think, for me to witness one school district next to another school district, these children barely getting any kind of services, supports of any kind, and these other kids are all given a laptop, right? So there's this one school district in Kansas City, they give out laptops like they give out pencils. Amazing. This other school district barely has anything going on. I mean, it's the disparities are literally between blocks in a city, right? So, and I don't have an answer for that. That feels like a really complicated political issue, with in terms of our values across the state about education. It's clearly disproportionate to communities of color. That's not a surprise. That's true about schools in general, but that is, I'm definitely seeing that. There's also this sort of suburban-urban difference as well. But the funding is huge. I don't know how, and this is the limits of my imagination, I don't know how you shift this if you don't put money behind it. So to me, a lot of times the answers to those questions have to do with the Department of Education for the state or other perhaps private entities that can provide support. But we have to be much more community-based about this. I think the same disparities that we see every day, school districts we care about, some districts we don't, are being played out in Technicolor during the pandemic.
And I think Alicia, I wanted to jump in here for a second.
Yeah, thank you, Amanda and panelists. I just wanted to share that we have an education panel that will be talking about this and other related issues with education and schools. That panel is this Thursday at 10 a.m. and if you have not yet registered for it, you are more than welcome to using the same registration link you did for this panel. Thank you.
I'm sorry, with Daphne, did I cut you off? I apologize.
It's okay. I was just going to agree with but one of the things we've seen here in Monroe County is that community organizations stepped up and they started donating, especially to the Rochester City School District. They started donating equipment, which I thought was great. And being that that was an opportunity, maybe that's something they can keep going forward, because the Rochester City School District was able to get equipment to young people for school and elementary pupils also. So I think even if your district does not have the money, just reaching out to other community organizations that can help meet the need. And they were able to do that here in Monroe County. So
that's great. I have another question someone asks. Can anybody talk about, I think you may have touched on this earlier, but can anybody talk about how substance use is changing during this time among youth? So not among their parents, but among youth themselves, I think is the question. If you know at this point, I mean, I don't know that we have, it's pretty early on in the pandemic, but Gzhel?
I haven't seen any data that's particularly focused on youth, but I do know that availability of substances is a kind of critical piece of substance use and overuse. You know, right when this pandemic first started and we were all advised to stay home, the number of jokes on Facebook about, oh, it's wine o'clock and quarantinis, and I mean, everything was surrounded with alcohol use related jokes. And they've continued, frankly. And so I think that, you know, adult substance use is probably modeling increased substance use among youth, would be my guess. I don't have any science to base that on. I haven't seen any data on it, but I do know that youth and young adults model what they see and what's available. So my assumption would be that we're seeing an increase in substance use among youth.
Either one of the panelists, either one, Daphne or Yo, anything further on that?
No, I would agree.
I would just agree.
Okay.
I agree that I think that there is, I think some of the drugs are not available, which makes people switch to other drugs. But I do know that people are still dying from opioid use, and that also there's been an increase in individuals experimenting with cocaine. I think it is happening, but I think the focus is not on that. So we're not really hearing news about it, but it is happening.
Yeah.
So
probably the stress of this time doesn't help that at all.
Well, and I know in Memphis we are seeing a fairly sharp increase in deaths from opioid use, especially in ages 18 to 25.
Mm-hmm.
And, you know, whether or not it's suicide, whether or not it's accidental overdose, often is discussed. I think that the fact that we're seeing this sharp increase in opioid-related deaths is pretty concerning for young adults.
This is a question, they haven't asked specifically of one of you, so I'll just kind of throw it out there. How would you advise us, and maybe start with Daphne on this one, how would you advise us to assist those who clearly are in need but refuse to accept it? Are there any techniques I can use to get them to be more willing little by little?
I would just advise persistence, because I think that when people know you're out there to help them, eventually they may come. I mean, a lot of times there's mandates, but it's difficult to engage people who don't think that they have a problem. So, you know, just kind of learning about them, if they will even give you the opportunity to speak with them. I think you have to be really creative. Maybe doing small gestures of, you know, letting them know, I dropped this off. I don't know if you need this, but I dropped this off to you. Start small and then work up into building a relationship with people where you can clearly see that they have a need. You know, meeting the need without really kind of saying, oh, you look like you need this. You know what I mean? So I would start small. Yes. Keep inviting. Yeah.
In the mental health world, there's a series of strategies that fall under the umbrella of what we call motivational interviewing or motivational enhancement. And we talk about rolling with the resistance. So you say, have you thought about, and the person goes, oh, I don't want to do that. That's fine. I understand you don't want to do that. So what other things might you do? I think that that's what you mean, DAPHNNE, when you're talking about presence and relationship building, that you as a provider don't give up, right? You're just there. When you're ready, I'm here. Meanwhile, let me know what I can do. I think that it's essential that we stay present as providers sort of across the broad spectrum of services that we provide. And that we let people know that there's hope, there's resources out there for when you're ready,
I think those are really excellent points. And can I just also add, just as a little thought, I think we also have to be careful that we are careful about our confidence that we know what people need and that we know that what we're offering is really help necessarily. I think you just might want to ask yourself, am I aligned with this person in terms of what they need? Have I asked them what they need? And maybe they've said, yeah, this is what I need. And then they won't take it, So they're like, oh, wait, but I thought that's what you said you wanted. I think that it's hard. Behavior change is hard for everyone, even when you're not in crisis. And I think that that should be the norm, not the exception, to know that people maybe stop and start with that kind of behavior, approach and then step back away from it. I've been struck by how many people in our clinic, for example, will not do online therapy, even though, with the therapist that they've worked with before. And my sense about that is they don't trust the medium, right? So what you're offering them now doesn't feel as comfortable. So I think it's important to have a conversation about that, right? As opposed to, and maybe to start, just to say, let's just talk about why you're feeling this way, about that. Trying to understand a little bit about it, as opposed to not, because I think there's always a reason why folks are not consistent in what they say and what they do. We just don't always know what it is.
Right. I guess I'm going to flip back one more time, if I can, to, I think we have time for a couple more questions. So this one is a little bit more back to family court. Have any of you had experience with children in the middle of family court custody disputes during the pandemic, family court issues? And if so, have these disputes coupled with the pandemic, how have these disputes coupled with the pandemic affected the children, if you've had that experience?
I can say I haven't had this experience directly, but I do know that all family court, at least in my area, is online. So they're still moving forward with family court. It's just a shadow of what it was before. So my guess is, much like things like foster care and child maltreatment, there's much less surveillance, much less assessment going on. So they're really operating, for the most part, on the thinnest amount of information. In terms of how it impacts the kids, I don't know, but I know that system is operating with really just kind of a quarter of a tank right now, just trying to do the best they can, but not really the robust sort of assessments that they would have done in the past, because you just can't do them.
And this one, I guess it's for all of you, but it's really kind of, I guess, a question for directed for the benefit of YJI and maybe other research people that are on this, but oh wait, my question just moved. Sorry about that. What are the practical and research questions that should guide us as we move forward to work to support youth and families, especially in this time of uncertainty and questions and all of that? Like, what should people be thinking about? I think we've touched on this here kind of separately in different answers, but now I'm asking it as one.
If I can start, I truly believe that best practices suggest we start with the needs assessment. You know, I don't think any of us want to spend time jumping in developing services that we think a community needs, only to find out it's not at all what the community needs or wants. So I think we need to start with a open dialogue about where do we start? What do you need? You know, we aren't going back to pre-COVID life anytime soon, if ever. And so thinking about what new systems do we need to put in place and what new skills do we need to make sure people have, we need to ensure that we're actually on target with that before we start designing new interventions or new systems for the court or youth services, for example.
Terrific. Anything else for that, you all? Okay.
I would just say that we need to start listening to families and youth, really listening and not just putting what we have just because it's there in our community, but really hearing people and what they tell you that they need. So.
It's interesting. All of your answers remind me, you know, I started my career doing advocating for children with special needs under the IDEA, you know, and it all revolves around an individual education plan. And many of your answers, I keep thinking that's what people need, right? They need their own individual plan, which even in my field, right, we see that a lot of times we check the boxes and say, okay, they're going to do the TV treatment and they're going to do parenting and without really assessing the specific needs of that family. So I agree. I have time, I think, for one more. Sorry, I just had it. The screen keeps moving. Oh, this is an interesting question. It says you guys have spoken, I think most of you talk about safe practices, and this person says people hardly adhere to safe practices where intimate relations are concerned. How do you stress the importance of these new social practices?
I think there's several different meanings to the term safe here. The discussion was if families need a safe place to come together, let's figure out how to do that. So do we, for example, think about not just all the sanitizing we need to do, but, plexiglass shields in a support group. I think that was the intention of the word safe that was used. I can't remember if it was Joe or DAPHNNE, but safe can have lots of different meanings in this context.
I think I want to go back to my lower your expectations point. I want to bring that back. I think we have to be kind to each other and understand that behavior is hard to change. And coupled with that, the basic need of this human animal is social connection, right? Solitary is a punishment in jail, right? So even inmates need to be with each other, right? So, I think we have to appreciate that this pushes against what we need, right? What we need on a whole nother level. So you're asking us to distance ourselves or have certain sort of behavior practices that are completely foreign. You don't do anything well that's completely foreign. So I guess that's what I want to say is I get that lower your expectations might also speak to getting more COVID spread. I get that, but I guess I'm hedging a little bit more on that side when it comes to intimate relationships within a family. People are doing the best they can. And for a lot of us, and perhaps for the folks at the CDC, it's not good enough. And they're probably right, because it'll probably spread more things, right? Like maybe that's true. But I think we also have to put some kindness into this picture and understanding that says, okay, so not able to navigate it exactly like we would like to navigate it. Because see, the risk is, I think if we press and press, people will just stop and they'll stop listening. They also won't, they'll tune out, very much like a teenager, right? Like, this is too much for me. We can't possibly do this, so I'll do nothing. right? I'm not going to do any of this. I'm not going to wear a mask. I'm not going to do any of the things because it's just overwhelming. So I would just encourage us to be baby stepping about it and giving lots of praise. Like there should be also, see, part of the problem with this is there's almost no reinforcement for doing the right thing, right? Because you can't see the virus, can't feel the virus, right? So if you've protected yourself from somebody else, you'll never know. So, and we, like little children, need reinforcement. So I think if we can find ways to reinforce ourselves, maybe that would be a creative thing to do in families, right? Where that was something that we really supported in each other, right? And I really like how you're keeping your little sister safe. I like how you modeled that for her, how you showed her how to do that. That's really great. I'm going to try to do the same thing. That could be more of a dialogue in a family to encourage this in a way that doesn't feel quite so punishing, I think would be good, because we just don't respond well to being scolded all the time. No one does. And I think that's how some families feel, frankly, is that they're blowing it. And I don't know what that gets us, really. So I think we have to find little victories, right? Wherever there's a little victory, and celebrate that.
Well, I think we've come to the end. We only have about 3 minutes left. I just want to say thank you so much for your time today and participating, and the YJI for putting this together for us. We've tried to get to as many answers or questions as we could and that were in the Q&A. I think we're going to try to answer or get some feedback on the other ones that maybe we didn't quite get to. Or make sure if they don't fit our panel exactly, make sure they're raised in the appropriate panel. But I just want to thank all the participants for hanging in there with us for our virtual first virtual forum. And then the visual note taker has been fabulous. I've never done one of these before and I've been loving it. So this has been great. And DAPHNNE and GAYLE, I just want to thank you so much for doing this. And I look forward to maybe having this conversation again in about 6 months or a year and see where we are.
That would be good.
All right. Take care,
Thank you.
everybody.
Thanks.
Thank you.
Bye.
Bye-bye.
I hope you can hear me. For those of you still lingering, thank you so much for joining us. I imagine everybody has a little bit of Zoom fatigue at this point, but the conversation by this panel and the wonderful work that Amanda did, I hope kept you all enthralled as it did me. So thank you to everybody who's joined us. A reminder, we have a virtual bulletin board. The chat will be displayed on, the link will be displayed on the chat box. If you feel you have remaining lingering questions or comments that you would like to post, please use that forum. We'll continue the conversation that way. And again, my many, many thanks to GAYLE, to DAPHNNE, to Yo, and to Amanda. This was an amazing way to kick this off. Thank you.
Thank you.
Bye, Gzhel. Take care, you all. Bye, GAYLE.
Bye.
Bye-bye.